Hi, I'm Amy McLean, and I'm going to talk about sign language as a potential communication system for children with autism. So, I have been acquiring sign language for about 7 years now. I started back in high school, and when I started working as an ABA therapist, my primary client base was with children who use sign language for communication. So I taught a child that was 7 years old, as well as a child that was 14. So both of my clients acquired different kinds of sign language. So the 7-year-old that I worked with acquired single word signs, and then the 14-year-old that I worked with had some single word signs but worked up to using full sentences. So, some primary advantages of using sign language. Sign language is easily portable, so as long as the learner is present, they are able to sign. This is kind of in contrast to other systems like maybe a PECS communication board, where the learner would have to have those items present. Another advantage is with most children, you can acquire your first sign at the age of 6 months, whereas a first vocal word would be around 12 months or a year. So, kind of have an advantage with sign language that a learner can establish earlier communication with a caregiver or someone in their life versus with a vocal repertoire. In addition, a lot of learners do see quick acquisition rates with sign language. So, for example, a learner I worked with, he came to our center in March of 2014 with around 60 signs, and by this year, June of 2015, we found out last week he's acquired over 280. So, kind of a nice rate of acquisition there. Another advantage with sign language is there's no need to worry about things like a battery life, like we would have to worry about with an iPod or an iPhone. Also, with other technology devices, we have to worry about things like the screen breaking or the device malfunctioning, in which case the learner is left without their way to communicate. Some disadvantages with sign language. Sometimes it requires a lot of physical prompts, especially when we're starting to teach a learner a sign. Sometimes that can be kind of intensive. In addition, some learners do use modified signs. So if they do encounter someone who does know sign language, there may be some signs within their repertoire that person would not know given their modified vocabulary. Kind of lastly, sign language in general, a lot of people do not know sign language. So just kind of keeping that in mind, if parents want to choose sign language as their method of communication, it's just kind of important for them to know, if a child has a PECS icon and they hand it to someone in the community and it says, "Help me," well, the chances of that being understood over the sign for help may be greater. Lastly, a lot of sign language movements, including letters, require some fine motor skills. So things like letters that require, different movements, those are often pretty hard to make. So learners may not be able to produce those, in which case they either would be modified or they may not be a candidate to use sign language. So when teaching a learner sign, kind of the introduction of signs, we may teach, a few signs at a time, often to help with things like stimulus control. So if we're only teaching them one sign, they may overgeneralize that to everything that they want. So if we're teaching them the sign for cookie, they may say cookie for everything they want. So we may introduce maybe their 3 most preferred items at once, so they're not just acquiring one sign. In addition, because a lot of signs do require more fine motor movements, we're going to often shape these signs. So a child may kind of produce an approximation for a sign that is not super accurate, So we'll kind of shape this over time to be as close to the actual sign as we can get it. And then lastly, once the learner has acquired it, a skill accurately for at least one setting, we want to make sure that we generalize that so they can sign it reliably across contexts. And then again, it's often a beneficial system for learners that maybe have tried to acquire a vocal repertoire and are unable to, but they do have the fine motor skills and the intellectual ability to produce signs. All right, thanks.